Many cultures used to view mental illness, such as anxiety and depression, as a form of religious punishment or demonic possession. In ancient Greek and Roman writings, mental illness was categorized as a religious or personal problem. There was negative attitudes towards mental illness, and this persisted into the 18th century, which led to the stigma of mental illness and unhygienic confinement of mentally ill individuals. Parkland Hospital in Dallas was founded in 1872 when 3 Dallas physicians opened the first permanent hospital, and has continued to grow and flourish since. The main differences in dealing with mental illness now and 50 years ago is the living conditions of psychiatric wards and the research done to help these individuals deal with their illness. 50 years ago, the living conditions of these wards were dangerous and extremely unhealthy. Now, thanks to the National Committee for Mental Hygiene and the National Mental Health Act, there are government funds to aid in research for treatment of mental health illnesses, which not only help to treat patients, but also to ensure their living conditions are up to standards. The most significant trends in the mental health field is that mental illness is better understood and less stigmatized. Managed care services are more commonly used now than hospitals, and research is continuously done now to better understand the various different types of mental illness to better treat individuals. As part of this research, we're also learning what causes certain illnesses, and people suffering from mental illness are no longer judged as being possessed or demonic. Mental illness is not an issue that will ever go away, unfortunately. It is something that people will continue to suffer with, and the only thing that we can do to deal with it is to properly treat those who are suffering from any kind of mental illness. Anxiety and depression is something that almost everyone will deal with at some point in their life. The only difference is the severity of which they have. Mental illness does not discriminate. Anyone is subject to falling victim to this mental health issue. It's more commonly seen in adults due to stress factors or family history. However, children and teenagers are subject to it as well. Parkland Hospital puts a big emphasis on ethical patient care. The Parkland Code of Conduct and Ethics outlines the standards for which the employees should abide by on a daily basis. The ones which are most relevant to me include excellence in leadership, respect, and stewardship. These are values which are extremely important in order to keep a professional workplace and to provide patients with the best care we possibly can. Health educators are vital in improving people's mental health because we're able to educate people on the illness, on ways to possibly prevent the illness from progressing. For example, for anxiety and depression, this would include decreasing stress factors and on proper forms of treatment. I believe that my passion for wanting to help others and my experience working in a mental health setting in the past, as well as my education in community health, make me the best candidate for this position.